This Good to Go segment is made possible by Spectrum Health Medical Group.
Gone are the days of one-size-fits-all healthcare. More and more healthcare providers are taking into consideration your specific needs, your lifestyle and history. It's called precision medicine. But in order to do that sort of customization, researchers are gathering boatloads of health data. Spectrum Health is helping with that effort by working alongside the National Institutes of Health, and they need you too. Dave Chesla is the director of the Spectrum Health Research Operations, here to explain how you can be a part of making history. Good morning. Good to see you.
Good morning. Thanks for having me.
I guess we begin our conversation by talking about precision medicine. What does that mean?
Yeah, precision medicine is a novel approach to healthcare. It kind of breaks away from the one-size-fits-all or the cookie-cutter type of healthcare that's been I guess, historical for us. And it really breaks it down to we are individuals, we are not numbers. The law of averages does not apply to everybody. So really precision medicine is catering healthcare, so it's precise to an individual.
It makes so much sense, but it also, in order to do that, it takes an immense amount of work, and that is what you are partnering up with NIH for, the National Institutes of Health, to do this All of Us research. Tell me a little bit about that.
Yeah, the All of Us research program has an audacious goal of enrolling 1 million individuals that live in the United States. It's very intentional about recruitment of diversity to ensure that everybody is accounted for, every community, diversity in every way that you can measure it, whether it's race, gender, ethnicity, geography, age. It's really intentional about that aim, and that's what really differentiates this program.
Okay, but why do you need that many people? What's the importance of gathering that much information?
Yeah, that is absolutely at the foundation of the All of Us program. 1 million requires statistical strength with diversity. So, you know, with 1 million individuals, it will be the largest research program in the history of the United States. It is longitudinal, and therefore we'll get multiple data points to better understand individuals, what keeps them well, what may make individuals sick. But really, to your question, it is for statistical robust strength.
So a 52-year-old woman who smokes, who never gave birth, who da-da-da-da-da, then you know by having that many people that you've looked at kind of what she needs, right?
Sure. At 1 million individuals, it takes rare and makes it not so rare, because you're going to find other individuals with similar attributes, 52-year-olds old, female with the other attributes you described, and you're going to find populations of that across the United States. And then you can start doing statistical measures against geography and other attributes of their health history.
In the end, this means better care for patients, I'm sure.
Absolutely. Better care for individual patients, better care for populations and communities, because we have a better understanding of what keeps people well and the environmental exposures that might impact illness.
Okay, so in order to get 1 million people, you need folks to participate. So what is required of a participant?
Yeah, absolutely. They start on our webpage. They fill out a brief survey that's roughly 1 to 2 minutes. It's just an interest survey, so we better understand how best to engage you. After that, we reach out to them either via phone or mail or email and send them a code that takes them to the NIH website, allows them to understand more about the program and understand the commitment for what they're signing up for. If they agree to consent, they'll be asked to fill out 3 surveys. Surveys are largely about things that we wouldn't capture in traditional healthcare. That's going to be sleep habits, dietary habits, exercise, family history.
Yeah.
That begins a participant journey. They will schedule an in-clinic visit with us at Spectrum Health, where they will be asked for a biospecimen donation, which is blood and urine. And then throughout the next year, they will be asked to fill out 4 additional online surveys that really speak to some other, health indicators or wellness indicators.
This is confidential, and the cool thing is they have access to the information about themselves, right? So that they can start benefiting by sharing all of that.
Yeah, absolutely. You hit on a very key point there. Participants are partners. That's very rare in research. Research traditionally does not engage healthy. Usually you wait until you have an illness, then you react to a research study because it's better than the alternative. But as a participant, you have transparency. You get to see your own data. You also get to see what happens with your sample, which is completely novel.
All right, well, you can learn more about the All of Us research program and take that first step to get involved on the Spectrum Health website. We have put a link to it on our site, plus a phone number. Go to WZZM13.com. You'll find it there. Thanks for doing this. It's really interesting. It'll be fascinating to find what you discover.
Yeah, thank you. We look forward to see how West Michigan does with this, and hope that everybody will join us and become 1 in a million.
Neat.